Welcome back. If you've just joined us, you're watching the news at 10 live on Channels Television. A reminder of our top stories. At least 4 persons killed as fresh violence erupts between farmers and herdsmen over land dispute in Mambila Plateau, Taraba State. Parents of schoolgirls abducted by insurgents from college in Dapchi, Yobe State. Alleged neglect say that no one's talking to them. Federal government seeks more international collaboration in tackling irregular migration, pledges military respect of human rights in the fight against terrorism. And at least 36 persons killed following Turkish airstrikes targeting pro-Syrian government troops in Afrin, northern Syria. For more on our top stories and others, please visit our website. It's channelstv.com and on youtube.com/channels, where you can find our videos. Log on to m.channelstv.com to watch us on your mobile device, or download the Channels TV app for Android, iOS and Windows devices from their respective stores. The Channels TV and Channels 24 app will give you access to news and updates. You'll also have access to the Eyewitness feature, which you can use to share those pictures, videos or news of happenings around you. Just install the app, then tap and swipe to reveal the menu and follow the instructions. The death toll from the latest Lassa fever outbreak has hit 72, barely over 2 months into the year 2018. In response to the situation, the Nigerian Center for Disease Control, the NCDC, has escalated the National Lassa Fever Working Group to a National Emergency Operations Center. However, it appears a lot more needs to be done by government at all levels, with members of the public playing their part. Our correspondent Yomi Otaigbe reports.
Fever outbreak in 2012 was described as the peak of the disease in Nigeria, since the acute viral hemorrhagic fever was first identified in Borno State, northeast of the country, about 50 years ago. In that year, 1,800 suspected cases were recorded, with 70 deaths. Although the number of suspected cases after the 2012 episode has been lower, a look at fatality figures from 2015 up until the 2nd of March 2018 reveals that there has been an up and down movement. Between January and December 2015, a total of 40 deaths were recorded from Lassa fever, 119 deaths in 2016 and 71 deaths in 2017 during the same period. But with 317 cases and 72 deaths less than 3 months into the year 2018, the question is, what is or are the possible driving factors for the unusually high number of cases for this time of the year?
3 possible scenarios. Firstly, there could have been a change in the virus. Secondly, there could have been a change in the multi-mammate rat and its ability to transmit this virus to humans. Or thirdly, it may just be that our surveillance infrastructure and architecture has improved so much that we're simply finding more cases. It could be a combination of all 3, but that's really at the heart of the work being done by epidemiologists, virologists, all working together to get to the bottom of this outbreak.
So far, 18 states have been affected, with 85% of the cases focused on 3 southern states, Edo, Ondo and Ebonyi. Among the general number of those infected, between January and the first week in February this year are 11 health workers, 4 of whom have died. These calls for the strengthening of infection prevention and control practices in healthcare settings in Nigeria.
We have really stood out and advised healthcare professionals all across the country to do the right thing, use universal precautions all the time. Nobody comes in with Lassa fever written on his forehead. We have very simple, straightforward tests to diagnose the common causes of fever in our context: malaria, pneumonia. Every fever needs a diagnosis. And once you've ruled out malaria, then the next thing is start thinking about other causes.
With only 3 centers in Nigeria having the capacity to diagnose Lassa fever, taking charge of your health through environmental, Personal and food hygiene will go a long way towards protecting you and your loved ones from Lassa fever and other infectious diseases. Yomi Otaigbe reporting for Channels Television News.
Well, let's examine this issue further, and I'm now being joined on the news at 10 by a risk and health communications expert, Dr. Lawal Bakari. I want to thank you so much indeed for coming on the news at 10.
Thank you very much.
This is indeed alarming because if you have to look at the figures, what we have reported, 1,081 reported cases, 92 deaths so far, 317 confirmed cases in 18 states, Edo, Ebonyi and Ondo states being the worst hit. Make sense out of this for us.
Okay, so thank you very much once again for having us and for the work you're doing for the prevention of Lassa in the country. When the epidemiologic process in the country, what we usually start with is we put information out there to the healthcare facilities, to the public. If you see these symptoms, please report quickly. When a patient walks into the health facility and the health worker feels that this patient might have Lassa fever, they call the surveillance officers, especially from the local government or the states or the federal government. This patient at that level becomes a suspected case. Now, a suspected case, we will now get blood samples from them. We send them to the laboratory. Now, these ones that come back with positive for Lassa fever are now what we call confirmed cases. So as you can see, the number for suspected is quite large, over 1,000, but just 317 of them are confirmed. Another 8 are probable, which means that probably they died before we got them before we could get samples, but there's a linkage to another potential case that probably died or is affected with Lassa fever. So as it is right now, 317 confirmed, 8 suspected, 8 probable, which makes a total of 325 confirmed and probable. Out of these, we've recorded 72 deaths, which means initially there's a round going out, is it 90 deaths, is it 72 deaths? No. From the initial suspected that we have, 90 died, right? But from those that we confirmed with Lassa, 72 have been recorded to have died. So the numbers are not, and the NCDC records is still valid. It is what we are supposed to work with as a country. Indeed, around the world, that is the number the global community is also working with.
Thank you for that clarification. But some other troubling revelations that we hear, are we getting it right? Is it that the virus is mutating, as we heard in that report?
Yeah.
Could that be the reason why we are having this high figures fueling this outbreak?
Thank you very much. Now, that is very subjective to science. We need to, and I'm sure the NCDC also agrees, we need to improve our laboratory capacity in the country. Diagnosing Lassa fever is not enough. We are supposed to also go deeper into being able to differentiate the particular serotype that we are dealing with, which is a lot of work that is going on in the laboratories and possibly even outside the country. I know some specialists are also considering coming down to Nigeria to participate in the process. In terms of what I personally feel is happening at the moment, we are able to detect more cases at the moment, and I hope that the number continues to rise in terms of detection. We need our detection capacity to rise as a country. For instance, there's a flu season in the US. They have over 40,000 cases detected. As a country, we need to be able to even understand the scope of spread of Lassa fever in this country. It's endemic already. We first detected the first case over 50 years ago, which means the first case was detected in the northeast part of the country. Now we have cases recorded in the southwest, in the southeast. It means the spread is here, and we need to know the real how far it has really gone into the population. Now, that might mean that in coming years, we want to be able to detect more. The challenge we are having is the number of deaths, which is associated with how fast people present themselves. When people I was watching an advert earlier, somebody presented with fever, and the next thing is they're presenting with anti-malaria drug to treat it. Precisely,
because I'm wondering if these multi-mammate rats are responsible for the transmission of this virus, one wonders how to identify that particular rat. Is it the one that lives in the bush, or is it the one that stays in the homes?
Right. So initially, when we talk, the multi-mammate rat is the one that we've been able to primarily link it to, but recently other rodents have also been able to demonstrate that. In any household, we know that it is not only Lassa fever that animals can transmit to human beings. So indeed, it is not right for any animal to actually, especially rodents, to cohabit with human beings. It's not right. It's not a domestic animal. So indeed, nobody would find a rat and start checking if it has multiple breasts, on the anterior surface, because multi-mammate just means multiple breasts. and they are usually smaller. But nobody has the time to start examining a rat. Rats don't even wait for you to do that. So what we are preaching is just prevent rodents into your household, prevent rodents around the food you eat, prevent rodents in your community. To do this, it's around food hygiene, it's around environmental hygiene, it's around personal hygiene also. So really, the transmission of Lassa fever, however, is not just from the rodent to human. And that's why in the response, the Ministry of Agric have to be a central part of the process. However, there's also the human-to-human component, which is what you usually find in health facilities and related things. That's why we usually look at it that the most at-risk population of Lassa fever are healthcare workers. And that's why what we have to do is to make sure that to protect the healthcare workers by improving infection prevention and control practices in health facilities. I
must thank you so much indeed, Dr. Bakari Lawal, for talking to us here on the News at 10, a risk and health communications expert. Many thanks indeed. Activities at the Asaba International Airport in the Delta State capital are about to come alive again. This is according to the State Governor, Ifeanyi Okowa, who undertook an inspection of the renovation work at the facility. He gave the assurance that work will be completed on schedule according to specifications. The airport was downgraded in 2015 with flight operations limited to only -8Q400 aircraft or its equivalent.
Just started about the middle of January. I guess about the middle of January, and they've done barely just 4 weeks and a few days. I can see that there's a lot of activity in this place. Even getting into the airport, the level of activity that you see is quite encouraging, very much unlike what we did have in the past. And with this work that is being done on this section, the first, the 1.1 kilometer area, we've already seen that they've finished the milling of the place. They're already laying the crack relief layer, which I'm told in this section that in another 2 weeks they would have finished with it. It's very, very important, and we thank God for it. They've already created the crash road here, and with a drainage job that we did see there, massive drainage job and reclamation of the erosion-prone area. That's quite a lot, and we're quite pleased with them.
Governor Ifeanyi Okowa of Delta State. Work on Section 1 of the 4-section Apapa Wharf Road in Lagos under reconstruction is now 20% complete. The project, which was started late last year, has a 1-year completion period. The project manager from the Ministry of Works, Power and Housing, Mrs. Olukorede Kisha, says that obstruction of right-of-way by underground gas pipelines and cables greatly slowed down the pace of work. Correspondent Olu Phillips reports.
Work pace at the ongoing Apapa Wharf Road appears to be progressing. In the past few months, the outward bound section of the Wharf Road was closed for reconstruction by a consortium. Following reconstruction efforts, work on these houses has caused some level of inconveniences for motorists, which may have prompted the officers of the Federal Ministry of Works, Power and Housing to ascertain pace and level of work done.
The time that the contractor said they will complete this project is June, and we're still standing by it. Why we had a slow start is because of all these gas pipelines, and it has been resolved. And then the rains. But now, even during this rain, they're devising means of walking in the rain. They're trying to do a canopy now, a mobile one, that even while it rains, they can walk.
Contractor is close to 20% completion now. As of today, they are about 16-17% completed. That's the completion. So, and at the rates at which they are working now, in bearing all odds, they should be able to complete it in time.
The project has been divided into 4 sections for ease of construction, with just one of those completed and will soon be open to traffic.
It is, given the pace of work now, you know, they work day and night now, and we have almost surmounted all the relocation problems. Initially, we had constraints on relocation of facilities. We will talk about the rains, Apapa being a place with high water table. So with the increase in the pace of work, working day and night, I think we will meet the target.
By mid-year 2018, the job is expected to be completed. If they do, only then can motorists finally heave a long sigh of relief. Olu Phillips, Channels Television News.
When the news at 10 returns, federal government to launch the Economic Recovery and Growth Plan Focus Labs, expected to attract $12 billion investments to the country on March 12th. That's some business news. Join us again.